Today we'll be chatting with Derrick McBride, who will be teaching a specialty class during our conference this year. Derrick, thank you for talking with us today.
Thanks for having me.
This year during the FASOMA Acupuncture and Asian Medicine Conference, you will be teaching on shoulder girdle, testing, assessments, and programming. Can you tell us what inspired you and led you to create this class?
Yeah, absolutely. So this has been like a long time in the making, and I teach this material along with the rest of the body in-person weekend seminars. Um, but really, so there's two classes that I'll be teaching. The first one will be about orthopedic and muscle testing for the shoulder. And that's a lot of your basic orthopedic tests that you would get going to traditional like sports medicine, going through a traditional sports medicine program. So that'll be all your specialty tests, like job relocation tests, EC joint impingement, supraspinatus impingement, those sorts of classic sports medicine tests that let you know exactly, like within our world, exactly where the stagnation is. So over the years, Whitfield Reeves is my main mentor, and I was actually shown a treatment of his while I worked at a sports medicine facility in Santa Barbara, probably about 12, probably a little bit longer, 12, 13 years ago, maybe. And it was for treating impingement of the shoulder, which I was working in a classic sports performance and training facility, as well as like a orthopedic rehabilitation facility. And shoulder impingement is notoriously very difficult to treat because it's right in between the two bones, between the humerus and the acromion. So it's really difficult to get into that space. And I was shown this treatment by an acupuncturist that I worked with of threading that subacromium space. I was like, this is brilliant. And then running electrical stim between it. And he was like, well, if you want to learn this, the only got to learn this from right now is Whitfield Reeves and Boulder. So I kind of started my trajectory towards acupuncture and the needle. But I came into acupuncture with this orthopedic and sports medicine background. And Whit and I have talked for years about how important it is for us as acupuncturists to be able to orthopedically test where stagnation is coming from, and what anatomical tissues are creating that stagnation. So what seems like the large intestine meridian for shoulder impingement is actually supraspinatus, which is part of the small intestine meridian. And that greatly changes your treatment. So step one for me is to be able to orthopedically assess where that local stagnation is. And that's really what drove Whit and I to work together to create this program that's all encompassing for the body of orthopedic and muscle testing, specifically designed for acupuncturists, because you can go through the other sports medicine stuff, but it can be a little bit more dense. Maybe some of it doesn't apply to us. And we're probably not going to see a whole lot of ACL tears. So to learn anterior draw test and things like that maybe isn't overly important, but I really try to condense this stuff down for what's most important for what I view and what I see in my practice. So that's the first course, orthopedic and muscle testing. Then the second course is stuff that my background is, I've worked as a strength and conditioning coach for the last 14 years, I would say. And that is more, the second course is more about the functional movement side of things and really trying to tease out why that stagnation may be there. So, for example, a lot of times that shoulder impingement issue comes from the scapula not rotating properly. So if the scap doesn't rotate properly, the acromion can't get out of the way, and then the head of the humerus bumps up against it and impinges those subacromium structures, such as the bursa and the supraspinatus tendon. So how do we now assess scapulothoracic rhythm or scapulohumeral rhythm and how the scapula is rotating around the rib cage as the arm goes up overhead? And then to take the next step further, what's functional exercises that we can prescribe for it? And again, I try to condense all of this stuff for acupuncturists, make it simple, make it easy. We're not bringing in barbells and all sorts of things but a lot of it's body weight type stuff. Many times there's similarities with yoga and yoga positions, postures, flows. So, things that acupuncturists probably are a little bit more accustomed to and a little bit more familiar with and easier to implement within the clinic of the acupuncture space as opposed to like a full-blown sports medicine practice.
Very cool. And when you and I talked months ago, you had said that the shoulder joint was your favorite part of the whole body. Can you talk to us about why that is?
It's the craziest. There's all sorts of stuff going on with it where it's like elbow, you got flexion and extension. You got some supination and pronation, at the elbow joint as well. But the shoulder, particularly, I call it the shoulder girdle as well, right? Because it really encapsulates like this whole area. And the course that we're really talking about, we're kind of leaving cervical spine out of it because that, although part of it, as we know, many of the muscles that move the shoulder blade, such as levator, scapula, and upper trapezius, attach into the cervical spine. We're really looking at the scapulothoracic joint, the scapulohumeral joint, and the humerus joint itself. When we talk about the shoulder, a lot of times people think just like rotator cuff, or deltoid, and these things right around the glenohumeral joint. But we have the acromion clavicular joint. We have the sternoclavicular joint. We've got weird things that happen at the clavicle that honestly I don't even give much weight to in the clinic. So I don't really talk about that much, but the way that the scap moves, the way that the glenohumeral joint should work in concert with all of the different rotator cuff muscles. A lot of times, again, if we have some background in some like classic physical therapy stuff to strengthen the rotator cuff, we're doing external rotations. I don't know if you put external rotations, internal rotations. That's not really what the rotator cuff does. So I really like speaking on that because many times what the issue is in the shoulder is not what you think it is. Where, low back pain, almost always it's quadratus lumborum involved in some, it's important to know, it's important to go over. You see it so much clinically, but as far as interesting little things to uncover, that's a little bit more of like a detective story. The shoulder is probably the number one for me in that regard.
Awesome. Thank you for sharing that.
Yeah.
What would you say is the clinical application for this class that you will be teaching?
Yeah, so I liked how I was able to do two parts. So thank you for that. Part one, every acupuncturist can use in the clinic right away. When I teach these in-person workshops, I always get feedback right away of someone like, you know what, I was treating this anterior shoulder pain as biceps femoris, long head of the biceps. But really when I did the test, Speed's test was negative, which is a long head of the bicep test. But I had 3 positive AC joint tests. And as a result, I treated the AC joint and they got much better in a short period of time, as opposed to my previous 3-4 treatments. So right away, if we can tease out, there's a lot going on at this anterior shoulder. We've got long head of the bicep that ties in there. We've got the AC joint. Again, we got the supraspinatus. We've got the subacromium bursa. So to really get very good, the beautiful thing about acupuncture is how precise we can be. But we need to know exactly what tissue it is that we're treating. In the first course, we'll provide every acupuncturist that takes it the confidence. There will be lots of hands-on work. So the confidence and the ability to tease out those different structures and to be able to really figure out, like, differentiate between those different structures that are all very close to one another. And the patients are going to be like, my deltoid hurts every time I raise my arm up. And, we can tease out the deltoid, we can tease out those other things and just be much more specific with our treatment. And then the second course, that is definitely going to be for the acupuncturists that are interested in taking the next level as far as sports medicine practice goes. All of us are treating pain, unless if it's strictly a fertility clinic. I would imagine just about everyone is treating pain. So everyone will benefit right away from the first course. The second course, again, we're going to start looking at these deeper movement patterns, trying to tease out the difference between mobility and motor control, which is hugely important because that changes the course of what we do. And then from there, you'll have tools to prescribe very specific exercises if that's the direction that you want to go. And I've gotten a lot of feedback of, acupuncturists that are interested in taking those courses from, physical therapy groups or functional movement groups, but all of the information kind of goes over their head. And I've tried to, since that's my background, tried to boil that down to what I've seen acupuncturists are going to be most likely to be successful with and most interested in.
Wonderful. And can you share with us your professional history? I know you already touched on it a little bit, but if you can share a little bit more with that.
Yeah. So growing up, my desire, I was always in athletics. I was always interested in every aspect of athletics. My aunt was in sports medicine, so I spent a lot of time with her growing up and with my strength coaches. And I always enjoyed the training aspect of things and the competition and the medical side of things. So I always knew I wanted to do something in sports medicine ever since I was a little kid. So that was my direction 100% of the way. My undergrad was from University of Pittsburgh in rehabilitation science, which was their pre-PT program. So I was planning on going to physical therapy school. After I graduated, I moved out to Santa Barbara, California, because I had to get out of the Northeast. Ironically enough, like we just talked about, I just moved back to the Northeast to Pittsburgh. But so I had to get out and just wanted to experience something different and new. Started working as a strength and conditioning coach at this facility in Santa Barbara. We did a lot of acute rehab, post-surgical stuff. We did a lot of like performance training stuff. I was a strength coach to a tennis academy out there, while also working more of like on the floor as like a physical therapy aide would probably be the best way to describe it. And that's where I was introduced to acupuncture and decided that the needle, I saw the needle created the most change the most quickly within the practice. So I really wanted to go and learn that. That took me to Boulder to eventually study with WIT and go to acupuncture school at Southwest Acupuncture College in Boulder. The whole time I maintained working as a personal trainer and strength and conditioning coach while I was in school. And then shortly after, and then I've kind of transitioned a little bit more into more of the clinical role over the last 9 years. Worked in a big sports medicine facility called Denver Sports Recovery, working with a bunch of professional athletes, a bunch of other practitioners, muscle activation technique. I ended up becoming a fascial stretch therapist during that time to add to the toolbox to improve mobility dysfunctions. Continued on with a bunch of different trainings in functional movement, corrective exercise work through the functional movement systems guys. And then started private practice again, probably like 6 years ago in Denver. And again, continue working with athletes. I do obviously sports acupuncture. I do corrective exercise, functional movement assessments, metabolic testing, consulting with coaches for conditioning programs and for strength programs, trying to improve movement efficiency is a lot of what I've worked on kind of within that world. So I'm still very much in the movement world, but more of like tinkering with things and making sure that they're working properly so we're not losing energy outside of the system. And then a lot of injury treatment along the way too.
Almost like optimization of the
Yeah,
body.
a lot of it. Yeah, it's like the whole gamut. Like, many of my patients are coming in injured, and then we're treating the injury. We're getting them out of pain. We're assessing their movement ability and then their movement capacity, and then we're building on those, although bringing it all the way up to this functional level where now their corrective exercises look exactly like their strength training program that their strength coach is doing. And we're just completely bridging that gap between there so that the injury risk greatly reduces, which is a major issue within all sports medicine practices. It's like, we don't always bring it all the way up to a functional level. It's like, yeah, everything looks fine, but it's like all the pieces aren't integrated and working together quite as efficiently as what they should.
Yeah, interesting. Thank you for sharing that.
Yeah.
What would you say is the success rate of using your technique in the clinic?
So the tests themselves that we're going over, as far as like the speeds test, the AC joint test, all of those are so easy to implement that by the end of like the weekend workshops I'm doing with people, they feel very confident going into it, and like they're able to tease those things out really, really well, and starting to understand like kind of how all the anatomy comes together, and a little about how to like put force into a tissue and see either how it's able to maintain its integrity or if it starts to lose its integrity a little bit. So I'd say the feedback I've gotten, at least, like I'm not in the clinic with people, but the feedback I've gotten has been really high success rate of being able to really tease out these tissues and to feel a lot more comfortable with their local treatment, but then also starting to think about how that may change distal treatment as well.
Awesome. Could you share with us a case where you had the best success using the knowledge that you're going to be sharing during your class?
I'd say the thing that that makes me, it happens all the time of, again, patient comes in, anterior shoulder pain, and they're like, oh, my PT told me it's my long head of the biceps, or my coach told me it's a long head of the biceps. We do all the tests. We have negative tests for those, but 3 positive AC joint tests. And then, we're able to show objectively that that's likely not the main pain generator. We treat that pain generator, and then like, oh my gosh, that's the most relief I've gotten in 6 months. And then that you're on the right track with that. So that's a pretty regular occurrence. And, I think that's like a really positive thing to have in our toolboxes. But the thing I'm most excited about is, again, this differentiation between mobility and motor control, which I get into in the second course of the weekend. And really, like, the basic premise of that is not all tightness is due to actual limited mobility. So many times, and this you'll see a lot with the shoulder, and I have slides of a patient that I worked on, who again has been through the gamut of PT and things for years and years. He can't raise his arm up above his head. His arm stops before he can get it all the way up above his head. And so I assessed him standing, and then I brought him onto the table and laid him flat and had him raise his arms up over the head and full range of motion, an extra 15 degrees of range of motion. And what we did is we changed the stability demands of the system. We basically eliminated the stability demands of the system. So now the body doesn't need to coordinate that pattern. It can just fall into place. So if it can happen passively with less stability demands, then it doesn't matter how many times you stretch that individual shoulder out. If anything, you're likely going to create more issues for that patient. That's a lack of stability. That's a lack of motor control as opposed to a lack of mobility. So being able to even start thinking about those things, and I feel like I say this all the time, but I feel like as acupuncturists, we're already taught to think this way. And it was one of the greatest benefits of going to acupuncture school for me was it helped the way I thought about movement, because we think of these things through like hot or cold, excess, deficient. We understand that there can be a local excess from a more global deficiency. And it's the same sort of thing as mobility, motor control. It could look and feel tight, but it's actually from a lack of stability. And to be able to tease those out, and that's one of the things that I'll go over, particularly when it comes to the way that the shoulder blade moves. That's really important because people stretch their lats and stretch and stretch and stretch. And it's like, it's not the lats, it's the way that the nervous system's coordinating this movement pattern of the scapula. And that's what we need to retrain. Once we give it that stability, it no longer feels like it needs to freeze up and prevent against that range of motion.
Yeah, awesome.
Yeah.
So thank you, Derrick, for sharing your time and your knowledge with us today. This has been a really great conversation.
Thank you. I appreciate the opportunity.
Yeah, and as a reminder for everyone, Derrick McBride is going to be teaching on Sunday, August 27th. And like you mentioned, it's a 2-part class at 9 a.m. and at 1:30 p.m. This class is being offered live in person in Fort Lauderdale Beach. And you also can take this class virtually if you can't make it down to Florida. It falls under the CEU category of biomedicine. And this two-part class is a total of 6 CEU credits. So thank you again, Derrick, for chatting with us today, and we will see you all at conference.
Thank you very much. I'm looking forward to it. Should be fun.